Hi, I'm Dr. Susan Maples. I'd like to give you an idea of what it really looks and feels like to be inside a total health dental practice. I want you to pay particular attention to the experience of the hygienists and the rest of my team, the patients, both children and adults and parents, and medical providers, what it means to be part of a community where we've really bridged the gap between medicine and dentistry.
Our practice is very unique, to say the least. Each one of our team members creates a personal relationship, I'd call it a partnership, with the patient to not only help them achieve their desired dental goals, but their desired overall health goals as well.
This office looks at total health, starting in your mouth and the whole rest of your body, and how it affects you. For instance, my sister came here to have her teeth straightened and didn't know that she was diabetic, and Susan told her that she thought she might be diabetic and told her to be tested, and she was.
Going home at the end of the day after having multiple experiences, conversations, movements, with facilitative conversations with my patients, I go home at peace with fulfillment of love and joy and empowerment, knowing that I'm making a difference. And whether it was a significant difference or a small step of an idea towards an area that they're looking to work on is really something that I value.
I didn't think I was that sleep deprived until I got the appliance, and then the appliance changed my life for the last 2 weeks after that because of all the energy that I received and the responsiveness and how much healthier I actually received. So, saved my life.
We need to bridge the gap between oral health and systemic health. And I know that if I have my patients going to a dentist who believes in bridging that gap, that my patients will be healthier and take better care of their health and be more interested in their health as well.
When he first came here, he was ill. He was not feeling well at all. And Susan took all those teeth out. And with the teeth out, and with a couple of days of antibiotics, his sugar numbers just plummeted. And he was back to normal.
We're not all about teeth. We're about nutrition. We are about your physical being, your mental being. We're not here just, necessarily drilling and filling and preaching to patients about all the things. We're showing them why.
The patients really in today's healthcare system don't have someone who can really hold the container for everything that's going on for them. We actually take the time to make sure it matters and they understand what's going on with all the medications or what's happening with their sleep apnea or whatever's happening with their acid reflux, and how is that really, why does your dentist care?
My first identification of my daughter's obstructive airway was having Dr. Susan do an infant oral health exam and having the sole factor of looking into her airway and noticing that her tonsils were enlarged and that she was a mouth breather. From there, we investigated further with an appointment with ENT, and she was too young. We were turned away. Furthering a year down the road, we continued to see a decline in her health. She was not sleeping. She had stopped growing, and from that I pushed forward and became a huge advocate and started reading more, and alongside of having the partnership with our community and working with medical physicians and specialists, I was really, really able to gain momentum in saving Paige's life.